These are not easy interventions. It's not a matter of identifying someone and picking up the phone and calling 911. In fact, these are situations that can be fairly complicated and complex.
When I was 13, I had to get stitches, and the doctors realized what was happening and the police were called, and they didn't even ask me whether the police should be called. They just showed up, and the police were really adversarial about it.
So trust is key, and if a doctor can continue to communicate, we are concerned about you, we want to help you, we're not going to force you to do anything you don't want to do, including call the police, then it gives the patient a space to believe that these are people who can really care about her and possibly provide the assistance she needs to move on.
It's important that they know that there are risks that go along with them sharing, and hopefully the benefit outweighs those risks, but you do have a responsibility to let them know that there are times when you are a mandatory reporter. We know that we need to always make sure our patients know that what they're telling us is being kept confidential.
Some physician may ask the young person, do you want your boyfriend to leave the room? And the young person, especially if they're being sex trafficked, they will be afraid to say yes.
The best practices include providing that protection even before anyone else is called in. At the moment a doctor thinks someone is a trafficking victim, change the patient's name in the records, provide an alias. So I sometimes have been called to the emergency room to meet with a specific patient where I was given a name, and now I've been told at reception, well, there's no one by that name here. And that's actually great.
In terms of what might be safe or unsafe, if they're kind of like looking out the corner of their eye at this guy and they say, no, I'm not with him, but right, like pay attention, be observant about those things.
Initially, everyone wants to save these kids or rescue the kids. We talk about all the time, we don't rescue anybody, we assist kids because they have to actively be a part of this.
I think that impulse to rescue is very normal and really harmful and can be really problematic for somebody's kind of long-term recovery and healing that has to be about them.
I also think that there is no one right thing that you're going to do. There isn't something you can say or some magic thing you can do that tomorrow is going to change that girl's life.
The girls I know, they all wanted to finish school, they all wanted to be somebody, do something in life. We would always sit around and talk, and we would always just say, oh, well, we're gonna go out of this, we're gonna beat this disease, we're gonna stop getting high, we're gonna be singers, we're gonna be actresses. I know that they all wanted to do something. It's just the drugs and the life was holding us back.
As physicians, we are trained to act and we're trained to solve problems. And it's important in these situations to remember that we are not going to fix this person's life in one visit. Many of these patients have been in their situation for years, and many times the path to recovery is a long one, and we are one stepping stone in that path. It's important then to listen to our patients, to provide the information that they need, the resources that they need, and it's important for us as physicians to know what those resources are. Who are the people that we're sending these patients to? How will they be treated in the community? And lastly, it's important for us to respect our patients' privacy and to make sure that other people respect our patients' privacy.